To lead off, we have the enigmatic Professor Ian Anderson. He's currently Deputy Sec of Indigenous Affairs with the Department of Prime Minister and Cabinet, but any of you who know Aboriginal affairs in this country will have heard, seen or worked with Ian Anderson over the past, I'll be polite, 25 years. It's probably much longer because he's getting old. As a doctor, as a bureaucrat, as a research leader, and as a mentor and colleague to many people right across the country. So it gives me great pleasure to invite up to the stage Professor Ian Anderson. Thanks.
It's a funny thing about time, it moves in the same direction for all of us, old man. Pankana Ian Anderson yap palangina. Palawatrona, Parabana Trawalwe, Pramamarana, Contimina Mine, Ghana, Tiana, Hakana Mina, Nanena, Nika, Lenena. So I just want to build honour and respect to the Ghana people, and in the language of my mother's ancestors, Palawakani. Palawakani was a Creole language that emerged in the Bass Strait Islands when Aboriginal women were taken by force over a very long period of time and into a sexualised industry of sealing and labour, sealing industry in the Bass Strait. So Aboriginal women here from South Australia, mostly from the northeast coast of Tasmania, and also from southeast coast of Gippsland. I want to do two things in this presentation. Really talk to a small project that I was involved in over the last 4 years with a small team of 65 collaborators across the globe, looking at kind of doing a survey of Indigenous and tribal people's health across the world, and then kind of drop down and talk about what some of the implications I think this has for how we think through domestic policy. And I particularly want to riff off some of the comments that Alex was making about the need to shift the structure of the dialogue around Indigenous Australia from a deficit-framed approach to a strength-based approach, giving a live example of work that we are doing through the Council of Australian Governments at the moment and over the next 12 months as we revise what's called the Close the Gap, or the kind of the macro level targets that guide government decision-making across all Australian governments in the country. I'm going to talk a little bit about the context of this project. I touch on the findings, not really go into any detail, and then talk about the domestic policy implications. So the project was a collaboration between the Lancet and the Literature Institute. It was a commission project, if you like, but the kind of key objective here was to describe the health and social status of Indigenous tribals peoples relative to benchmark populations, but without any attempts to make inter-country comparisons. There are some very important reasons why we felt that this was not appropriate. There's a lack of standardisation of measures across populations. There are fundamentally different approaches to measurement methodologies, particularly around life expectancy, and also there are very different definitional issues that are framed around indigeneity across the 22 countries that we're talking. So what we're aiming to do is really capture the patterns of inequality rather than a comparative analysis. This was a project which had a relatively ambitious objective of trying to really do something far beyond previous international work in the space, and this really describes the scope of international studies where there's more than one country and in the measurement system. By and large, since about 1990, most of this international research has really been limited, not entirely, but been limited to Australia, New Zealand, the United States and Canada, what we call Kansas. Some focus across the circumpolar region, but very little research in other global regions. It was also quite limited in the scope of indicators that were measured, as you can see there, mostly life expectancy and infant mortality. The project, this is very basic descriptive epidemiology. I feel quite jealous of the capacity to do much more sophisticated analysis in other spaces, but when you understand the scope of some of these countries and the ability of their statistical systems, it is very descriptive. One of the keys, I think, to this project was really drawing on the very good will of our country collaborators. This was particularly important in actually getting beyond the English-speaking Kansas world. And we worked very hard to find country collaborators who understood their governmental data systems well, understood where to go and access data, and understood some of the quality issues around this data. Data was drawn from a range of sources, government sources, academic sources. The poorer the country was, the more limited the government sources, with the underdevelopment of governmental data systems. And as I will point out, I think at some point, there's very little data in here from low-income countries, which have very poorly developed data statistical systems. Indigenous status was recorded in 68% of measures, 88% were by self-report. In the absence of Indigenous status indicators, we had to rely on geo-proxies in some cases and on language proxies, with all the inherent problems of using those proxy indicators for indigeneity. Just a note from my Scandinavian colleagues in the Sami world, some of the best developed statistical systems on the globe do not collect and disaggregate data by ethnicity. And that meant that we are very limited in what we can say about the health of Sami peoples in Finland and Sweden and so on, in Greenland as well. Not Sami peoples, the Inuit people in Greenland, because of the legislative prohibitions on the collection of ethnicity data. And there's kind of I think, a very paradoxical irony here. In the late 1970s, when this legislation came in place, and this was really in the backwash of the Second World War and the misuse of data during the Second World War, Australia actually made, by constitutional reform, actually introduced, through the constitutional reform, in effect, made Indigenous peoples in this country, for the first time, statistically visible. There are some very complex issues that were in part of the background of this study, which were driving the ways in which we could find quality data, and it wasn't just the wealth of the country. This project has global scope. We didn't use a definitional approach to indigeneity; it just doesn't work. But we used this typology of characteristics that has been developed by the UN Permanent Forum on Indigenous Issues, which sets out 7 characteristics. I won't go through them as an indicator and a guide. And we, I think, required 6 of these 7 characteristics to be realised in order to decide on the inclusion criteria for country. The further you move away from the Western Pacific Basin, the more complicated and layered the histories of colonisation are, particularly through Africa and in Southeast Asia, other parts of Asia. There are political complexities around indigeneity in Africa. This is quite a contested term, but there are populations such as the Baka population in the Cameroon, for example, which are in many respects a classic Indigenous population, and there is an African Congress for Indigenous peoples in Africa, but these are by no means simple kind of definitional things that actually need to be understood in very complex social and political and economic histories. That notwithstanding, we thought that it was quite important to make sure that this project actually stretched across the globe, rather than in order to succeed. These are the range of measures that we chose to identify. They are quite limited. There's a strong focus around maternal and child indicators. In a sense, we thought that this is where, based on our review work, where we could find a set of measures that we could possibly get from most populations. But as we discovered through the project, some populations had very limited information. I think particularly in future kind of work, we'd like to do much more around the mental health, and there's probably a range of other measures that I think we should be looking for. Wanted to capture social indicators, economic status, educational status as part of this measurement project. The more we moved into the social measures, the more the lack of standardisation is a particular problem. That's because measures like economic status and educational status that are available really reflect the policy priorities of the particular country. So in some countries, about, for example, attainment up to year 12, in others about primary school or basic reading and writing. Just more to say. Number of indicators, again, ranged, reported from 2 to 20. Educational attainment and infant mortality were the most reported indicators. I think probably infant mortality is an influence through the Millennium Development Goals. High birth weight and maternal mortality were the least reported. Notwithstanding this, we found, in general terms, evidence of poorer health and social outcomes for most Indigenous peoples, but this was not uniform. It's very important. This was not uniform. It's not uniformly the case, and the size of the differences varied. So a pattern of inequality, don't take it for granted. There are some cases in particular populations where this was not the case for some measures, and the size of the differences varied across the globe. I'm going to briefly talk around some of the data. So this is a picture of the kind of spread that's available on the website. You might want to go and have a look, so when you can actually read it. But I just wanted to give you a sense of the range of countries that we're able to survey. We covered off on about half the global population of Indigenous peoples. They weren't comprehensive studies, but we had particular success, I think, in this is the first time that we have data from scheduled tribes in India. It's the first time we actually have data in one of these studies from China. That was tricky, and it wasn't comprehensive. So that I think that one of the possibilities in the future is to get more comprehensive data in China. Almost blew one of my chatty colleagues almost blew it entirely when he was having a chat to a couple of Chinese diplomats about it, who probably were feeling a bit testy about us having Tibetan data. But nevertheless, I think what it shows is that if you've got the right kind of reach methodologies into these communities and you're getting the right people to involved in the projects, this is actually possible. Education, economic outcomes, I think with the one or two exceptions, uniformly poorer outcomes. The nutritional measures were quite interesting, and unfortunately we didn't have enough nutritional data to really be confident about describing the patterns, but there seem to be two different patterns. One, a classic kind of pattern in a low middle income country, higher rates of undernutrition, malnutrition in childhood, but in a couple of the higher income countries, including Australia and Brazil, very different pattern with high rates of child malnutrition, child obesity and adult obesity. So it's a very different kind of pattern of nutritional transition, and again this is something which is quite interesting and needs to be explored further. I'll show you the life expectancy table. By and large, life expectancy outcomes were poorer and therefore followed the kind of trends of low wealth to high income countries. Just wanted to point out, I don't have a pointer, but those large rate differences at the end of this table, at the end of the high income countries, Australia and Canada, where you've got very significant remote populations. I think that that's part of the thing that drives the rate difference in countries such as Australia and Canada. The data on infant mortality, again, broadly fits the kind of global pattern. There's no big surprises there, but there are some differences in rate differences across income groups. I think that the overall message that I want to give to you around this stuff is that even though we find consistent patterns of inequality, if you want to understand the actual rate differences, you need to understand the historical and economic and political circumstances of that particular country. There are no kind of grand narratives we can build around models of inequality. We really need to look locally in order to make sense of that. I'm now going to shift tack and talk about the implications for domestic policy. I want to say one thing about this, and if you want to read more, we make a number of inferences for the Sustainable Development Goals and the global the global development agenda in some of our published work around this particular project. But there's a fundamentally important point I want to make around Indigenous tribal people's health is a global health issue. It is not an issue for domestic, just an issue for domestic policy. The ambitions around the sustainable development goals will not be realised without attention to these issues. And if I can reflect a disappointment on the Millennium Development Goals, the Millennium Development Goals had poor reach into problems of internal inequality. You can't make the same mistake the second time round. So the Indigenous and tribal people's issues need to be elevated up into the global governance systems. Now I want to drop down and actually say what this means for domestic policy, and part of this is drawn out of the SDGs. The first thing is that you absolutely need within, if you're going to address these inequalities, you need a policy focus. That seems fairly obvious. It's really obvious here in Australia, where we have quite a reasonably well elaborated Indigenous health policy frameworks. A number of these countries, it's absolutely silent. One of the big reforms at the moment in India is actually developing tribal health policy, and that is quite a significant shift. So we can't take this for granted. In some of the wealthier countries, this is an aspect of development, but it's not across the globe. The second is around the importance of quality disaggregated data by ethnicity. Again, this seems a fairly self-obvious problem here in Australia, but it is actually not done in other parts of the globe, which significantly limits the ability to actually monitor and track changes through policy. And the third is that this is about relationships. This is about partnership relationships, collaboration, working with Indigenous peoples, both at the global level, in effective models of through global governance systems, but also in terms of domestic policy. So I'm going to, I'm not going to finish just yet, so a bit more. I'm going to talk really about one of our key domestic policy agendas to try and elaborate how we need to think about this here in Australia. So in Australia we have a program called Close the Gap, established in 2008 as an agreement by the Council of Australian Governments to 8 high-level targets. A number of those targets are expiring in the next 12 months. So it's been one of my jobs within Prime Minister and Cabinet to actually lead the conversation through the Australian Federation around what the next set of targets should do. Now, this is quite an important conversation because it will set the policy platform for Indigenous developments for the next decade. There are a number of things that we've learnt over the last decade around having high-level targets. One is that provided a focused and data-led policy agenda, which and it's actually brought Indigenous policy back to the centre of the national policy debate. If you witness the kind of annual reports of the Parliament that the Prime Minister makes, this is a big deal, and it's a big deal for government, and the Prime Minister is leading that conversation. And the other thing that's quite important is that it sets a timetable for change. This is not, we're going to do it eventually, we're going to do this by the next 5, by the next 10 years. So it's it's a committed timetable for development. There have been a number of things that we have learnt though over the last decade. Buy-in by states was poor. This was actually seen, even though it was a COAG agreement, this was seen as a Commonwealth agenda. Now, the problem with that is that we are a federation, and in a federation, accountabilities are distributed. State governments have responsibility for education, delivery of education. They have a responsibility for delivery of parts of the health system. So we have a lack of tying of accountability measures to the level of the system in which delivers this. So this means that the annual reports, the Prime Minister has been actually standing up and providing accountability for what state governments are doing. And if you're not owning the target, you're not owning the responsibility for shifting the policy framework and the resources and the system. The other thing was absolutely true. The Indigenous engagement, I was going to say slightly underbaked, probably done, wasn't there, in the development of these targets. This is a COAG process. COAG works as a closed shop, and one of the challenges for us is to change this. So, and the other thing is that this without meaning to do this, what this done has really produced a deficit narrative of disadvantage. And I'll come back and talk about this. So I think the opportunities here are to address a number of those key things as we go forward in these negotiations, which are on the way. We're into the 6th month of these negotiations, and we've got a way to go, and with a delivery point around mid-next year. Indigenous engagement, I want to make a point about this, and because we are trying to push the COAG framework quite significantly. One of the really basic observations here is that governments don't do change. Governments can deliver services, governments can enable, governments can provide, but actually a lot of change happens within the agency of families, of households, of individuals. People decide to change, decide to do things that are going to help them to be healthy, help them to be educated and so on. And that agency needs to be recognised in the way in which we approach government policy. So it's also government has limited reach into the economy. We're not a centrally planned economy here in Australia, so government can't reach out and actually insist on businesses employing Indigenous Australians. So part of this is about understanding the reach and limits of governmental influence. So there are a couple of elements to how I'm hoping we can frame this engagement. This is not the first time that governments have spoken to Aboriginal people. People get irritated by that sort of narrative. So we want to build on the narrative and work that people have done over the last decade. The Congress of First Peoples has done some very important work in workshopping some key areas of policy in May. This comes into this conversation. And there has been quite a bit of heavy lifting and work done around the social and cultural determinants of health that absolutely frames up this agenda. So all those pieces of conversation, dialogue and engagement are there. There is a process that COAG has now endorsed and waiting for one jurisdiction, this one, to sign off on the process. We'll be able to go into Indigenous engagement that will occur over the next 6 months, and then finally, that should not be the end of the conversation. This is not an agenda of setting the framework, coming back in 10 years and saying, oh, how did we go? We need to bake in Indigenous partnership, leadership and engagement across the whole process. And there are two ways in which this needs to occur. I'll talk about regional and local decision making, but also at the top table. We are proposing to introduce into the COAG space an engagement by national leaders with First Ministers as part of the COAG process. Now this brings in what people call small p politics, but it's actually relationality into the COAG process, so that First Minister has to look at a senior Indigenous leader, who by the way has been in this space for about 20 years and will long outlast the Premier and the Prime Minister, and actually negotiate as part of the change agenda. The second, so that's the first thing, is actually changing the nature of engagement and making that into a meaningful, sustained agenda. The second thing is in setting targets. Something's happened. This doesn't work. Okay, all right, let's do it right. This is the last set of targets, most of which is expiring, not all these are expiring. Across all these targets bar one, there has been progress over the last decade. Yet when we report on these targets every year, and this last year in particular, most of the targets are not on track. Now there are three possible reasons for this. One is a failure of programmatic and policy investment. Haven't done the job. The failure to also achieve what I call horizontal locking across the government. So it's been one part of government that's driving the agenda. Education has dropped the ball. This part of government has dropped the ball. Or the failure to embed accountability across the Federation. But there is another really obvious failure. It's one that's called poor science. Targets are always a mixture of politics and science. The science around targets is what, in public policy, they call smart targets. So specific, measurable, achievable, realistic, and time-bound. Now, I know some of these targets were not smart at all. They're actually biologically unachievable. Can't say which ones. Might look at life expectancy. Yeah, okay. Just not following biological curves. Not done with the kind of back end of data analysis that actually looked at trends. Now, you want to. When you're looking at trends, you want to do harder. You want to go get that extra lift, but you don't want to go into the space where it's unachievable. What this does is reinforce failure. Every time the Prime Minister gets up and does this, it makes my job harder because I need to go and convince another departmental agency to work harder, and they're saying, well, why? It never works, okay? So that's one of the things that we want to do, and also, as I'll say a little bit more towards the end, build I'm really not doing very well at this. I haven't been an academic for 6 months. I've forgotten how to use the PowerPoints. And I now want to kind of shift. So this is a negotiating framework. This is not a done deal. Really? No. Can we go back? Can someone else drive this for me? Thank you. So this is one of the frameworks we've been developing up and going to use as part of the negotiation. One of the things I want to say about building a strength-based framework is you've got to build a strength-based narrative. So I want to shift the narrative to one that's aspirational. And we're proposing here prosperity as an aspirational statement. Interesting in getting some pushback around this, and I think that's really quite interesting. And it's mostly coming from my non-Indigenous colleagues. I think it's easier to talk about Aboriginal poverty than it is to talk about the aspiration of prosperity. Now in this we are actually framing this in broader than just economic outcomes. We're talking about social prosperity, talking about the kind of need for safe nurturing communities as part of prosperity, the kind of economic opportunities around building businesses, employment and economic development, looking at some of the environmental assets such as land and sea rights that Indigenous Australians have, and looking at some of those individual capabilities like health and educational outcomes in an integrated way. We're trying to shift it to a more comprehensive approach. So there are poor economic development measures in the last sort of targets, and mostly social policy measures, but to have a broader and stronger narrative with Indigenous cultures at the centre. So the aspiration for prosperity that's linked to a viable Indigenous cultures, cultures that are developing, changing and dynamic, and responsive to all those really important ethical conversations about the behaviours and values within families and within communities that need to change in order to be aligned to that aspiration for prosperity. The other thing I would say about a strength-based narrative is you need to get the measures right. You need to actually start to shine a light on Indigenous success. So, for example, the 18,000 this year, Aboriginal students in the higher education system, up by 10% from last year, growing faster than non-Indigenous students. That's one of the success things that's not in this range of measures. And then you need to shape the measures in ways. So do we measure poverty or do we measure growth in income and wealth, for example? The other thing I would say about this is that we absolutely must continue to focus on disadvantage. We can't not focus on the difficult issues, but we've got to bring greater nuance to it. Having said that, what has often struck me, and the greater nuance, metaphor for me is like an orchestra. You've got some piccolos, you've got some drums, you've got some first violins, you've got the whole thing playing. The amazing thing that I sometimes find is that you can play the full orchestra of Indigenous life, and sometimes people only hear the drums. So there's a bigger project out there around changing perception and attitudes.